Choosing your medical specialty, wow, that is a huge decision. And today, we're going to zero in on one of the most competitive fields out there, and one that's, let's be honest, often misunderstood. This is a no-nonsense framework to help you figure out if radiology is actually the right path for you. So you're at this major crossroads, right? And radiology is on your list. It's a field with some serious rewards, for sure, but it is absolutely not for everyone. The real question isn't just about whether you can do it. It's about whether the work itself is something you'll still be happy doing day in and day out for years to come. And you are so right to be thinking this through carefully. There's no simple yes or no answer that works for everybody. So instead, what we're going to do here is give you a framework, a way to honestly look at the facts and decide if this specialty truly fits you and your personality. Okay, so first things first, let's get past all the stereotypes. What is the actual day-to-day work of a radiologist? What is the core of the job? At its heart, radiology is a deeply intellectual job. It's all about becoming a master of anatomy and then using that knowledge to spot tiny, subtle patterns that tell a critically important story. And this brings up a really key dynamic of the job. You have this immense responsibility for getting the diagnosis right, but you're often completely invisible to the actual patient. This quote, this really captures the central paradox of being a radiologist. You're basically the detective who solves the medical mystery. You find the problem on the scan, but you're not the surgeon who goes in to fix it, or the doctor who manages the long-term care. You are that crucial link in the chain, but you're almost never hands-on with the treatment itself. So who actually thrives in that kind of environment? Let's break down what we'll call the yes profile. This is all about knowing yourself. You should seriously consider radiology if you get a real kick out of solving a complex mental puzzle, more so than you do from, say, performing a hands-on procedure. It's also a great fit if you're someone who really values a more predictable lifestyle after all the years of training. But here's the big one. You have to be okay with being behind the scenes without getting that direct thank you from a patient. And yeah, let's be real. The financial security is a factor, but that only comes after years and years of incredibly intense, focused work. Now let's flip the coin, because knowing when to say no to something is just as important. Let's look at the no profile. Listen, if the adrenaline of the emergency room or the satisfaction of a successful surgery is what got you into medicine in the first place, the quiet, intense focus of a reading room might feel, well, isolating. If you're someone who really needs that face-to-face connection with patients to feel fulfilled, this is going to be tough. And please, don't underestimate the physical side of it. Spending 8, 10, 12 hours a day staring at screens requires a very specific kind of mental stamina. Let's just make this crystal clear. It really all boils down to this fundamental difference. Are you the person who genuinely loves the intellectual hunt, the challenge of spotting that tiny finding and solving the diagnostic puzzle? Or are you the person who needs that physical, hands-on interaction, that direct human connection to feel like you're really making a difference? There's no right or wrong answer here. There's only the answer that's right for you. All right, let's move on to something super important. We have to do a crucial reality check and bust some of the biggest myths about the specialty. I want you to really let this quote sink in. This might be the single most important truth to understand about radiology. Just because there's no noise and chaos doesn't mean it's not intense. The pressure is just different. It's all internal. Because here's the reality. The stakes are incredibly high. A misdiagnosis, one little subtle finding that you might overlook on a scan, can have absolutely catastrophic consequences for a patient. The work isn't so much physically draining as it is mentally draining. It demands a level of constant focus and sharpness day after day that is anything but chill. So let's just be blunt about this. Do not choose radiology for superficial reasons. Don't do it just because you heard it pays well, or because you think you can avoid emergencies, or just because it's considered a top-rank branch. Those are terrible reasons, and honestly, they're a recipe for burnout. The only sustainable long-term reason to choose radiology is because your fundamental personality is a match for the actual work itself. So how do you make that final call? Here's a simple little test you can use for a really honest self-check. Okay, I want you to ask yourself these 3 questions and be brutally honest. First, can you genuinely, truly see yourself enjoying the process of just sitting and analyzing images for hours on end? Second, are you really okay with the fact that your most important contributions will be largely invisible to the patient? And third, when you really think about it, do you get more of a charge from mental challenges than from physical ones? If your honest answer to all three of those is a strong yes, then radiology is very likely a fantastic choice for you. But if even one of those gives you pause, you really need to think twice. And ultimately, this is the final truth. There is no such thing as the best branch in medicine. There is only the best branch for you. The goal isn't to pick the specialty that looks the best on paper right now. The goal is to choose the one that's still going to feel right, that will still bring you satisfaction when you're 40 years old, with a life, maybe a family, and years of your career still ahead. The real question is, what will that choice be?